is Fox 5 News, live in Las Vegas.
Right now, the pain caused by arthritis can force you to change your everyday activities, but one local doctor is working to change that.
Yeah, and he's live in studio with the details on the new ways he's working to treat the disease.
7:43 on this year Wednesday. Arthritis can be a painful and debilitating disease, and May is Arthritis Awareness Month. This world-renowned surgeon, Dr. Todd Swanson, is in our studio this morning. We're lucky enough to have him, who is constantly researching and designing new and better ways to treat the disease. He's the man I saw here when my hips were giving me problems a year ago. You gave me great advice, spot-on advice. Now I'm running 5Ks faster than I ever have, so I want to thank you for the advice. But let's talk about Arthritis Month. Thanks for joining us this morning. We're lucky to have you. Show us the difference between arthritis as far as a good hip and an arthritis-filled hip, I guess.
Okay, well, this is an x-ray of a pelvis, so you've got a relatively normal hip. You can see the ball and socket, and there's a nice space between the two. That's the cartilage cushion of the joint, and that's pretty normal. But when that cushion wears away for a number of reasons, you get a hip that looks like this. See, there's no space there. The cushion is worn off. It's bone on bone. That's a situation that you had.
That's exactly looks like mine a year ago. I had trouble just walking. I couldn't play softball without limping around the bases. And couldn't hold my children, things like that. What are some things that folks try to do to combat this short of surgery?
Well, I think there are several things that people can or should do. You know, one of the things that we're seeing very commonly now is obesity. And so many of our patients with arthritis are overweight. So if patients can lose weight, they're going to have less problems with their joints.
They can't reverse the damage, but just stop some of it. You can't reverse the damage,
but you can slow it or stop it, and you can stop some of the symptoms of arthritis. So that's probably the most important thing. Activity modification, get away from the pounding, jarring activities, go to smooth activities like swimming or cycling, perhaps.
But then you start talking about quality of life issues, changing your routine, changing the activities you love, and that's what happened to myself, and I ended up taking pain pills for a couple months just to mask the pain, just to hold my kids. But those are like lipstick on a pig type of things because they're just temporary. When you get to surgery, a lot of things you told me that have been in the works in the last few years have made great strides in the treatment of arthritis, and you brought some of them right here. This is a total hip?
Yeah, so there have been a lot of advancements in the last decade, both in surgical technique and in technology. So this is a total hip. This is basically the part that the ball attaches to. The socket would go here. So that's sort of a standard total hip replacement.
This has been around for years.
This has been around for years, but it's changed. So we used to use cement. Now we don't use cement. We have the cementless technology. We have much better bearing surfaces.
How long does this last?
This one will last, depending on how it's put in, what's used. It could last even someone as young as yourself, your lifetime.
Really? But you got to modify your activities on a total hip.
There are certain things that we recommend that you don't do. The pounding activities we recommend in general you shouldn't do, but I'll tell you, most of my patients, when I tell them that, they say yes, but I love doing those things like you do. You love running, so patients continue, and we haven't seen major problems with the newer technology, with the newer bearing surfaces.
This is only a few years old, and this is what I have right here.
Yeah, this is exactly what you have. This is a resurfacing, so you can see you don't remove as much bone, and that's one of the nice things about it for young patients like yourself, is you don't remove as much bone.
And so the total hip is still an option for me. If this
total hip is an option. If this ever fails, and this is going to last a long time, they last 20, maybe 30 years, and when the time comes that you have to have it redone because something fails, which could or may not happen, we can go to a total hip replacement.
This is my x-ray right here, and you can see that's pretty much all it is. Weighs about a pound. They put it in my hip, and I feel great. This last item, is this the super knee?
This is probably the super knee, yes.
30-year knee, is that right?
This is the one that's advertised as a 30-year knee, and that's based on simulator results in the lab. But basically, a total knee is sort of shaving off the arthritis. Some people think you chop out the whole knee and put in a big hinge. It's not like that. Through a small incision, we use a little mini incision technique for both hips and knees.
And you have patents on a lot of those.
Yes, we basically shave off the arthritis, resurface it with a piece here and here. There's a plastic shim that becomes your new cartilage. There's been advances in the way we manufacture this, so they last 2 to 4 times longer than the plastic we had 10 years ago. So the knees last much longer also.
All right, Dr. Todd Swanson, thanks for joining us to show us some options available for those who are suffering like I was just 1 year ago. Thanks a lot. And information on how to get a hold of you and this entire interview will be on fox5vegas.com later on this morning and throughout the day. Let's get to traffic right now. Thanks a lot, Dr. Swanson. Let's get to Mr. Chris Brown here.